Good evening, everyone. Welcome to today's session dedicated to marking the Universal Health Coverage Day, an initiative by Voice of Healthcare. Our focus today is on a powerful and urgent topic: the price tag on hope, emotional, social, and financial costs of childhood cancer. I'm your host, Subhangi, and I'm honored to be guiding you through this important conversation. Childhood cancer. It is not just a medical journey, it is an emotional turbulence, a turmoil, and far too often a financial crisis that pushes families to the edge. And behind every diagnosis is a child carrying a burden no child should ever know. To help us understand this better, we have with us Ms. Poonam Bagai, the founder and chairman of CanKids KidsCan organization, vice chairman of Pallium India, a central council member of the Indian Association of Palliative Care, a member of the ICMR, CECHR, governing council and operations lead at ICCI, and the CCI WHO SEAR Representative, and above all, a cancer survivor herself. Ma'am, you are so strong. And thank you so much for joining us today.
Thank you, Subhangi. Good to meet you.
Good to meet you too, ma'am. It is indeed a privilege to have you here with us today. So, starting off with, when we say the word bachpan, most of us get reminded of our older days, playing with teddy bears, visiting the mela, holding our parents' hands, running in the fields with our friends, and all kinds of yellow, basically. But for lakhs of children with cancer in our country, bachpan also looks like the epitome of the utmost level of suffering, which no child, I think, should ever have to endure. And with the medical costs rising endlessly at an alarming rate, what do you think is the current economic scenario for childhood cancer patients from underprivileged families or maybe in rural areas?
So you're right, Subhangi. Bachpan, childhood is a time of endless possibilities. It's a time of dreaming. It's a time of childhood. And when a child has cancer, he does lose a lot of his childhood because he's in hospitals, he's shuttling between home and hospital, he loses out on his school, he loses out on his friends. Often he loses out even on family and siblings because he's away to the hospital in another city with a parent or both his parents. So families do tend to get broken up when a child has cancer, right? But the good news is, and this is good news, India is really, really it's becoming a case of how much is actually available. So, over the last couple of decades, we have been working regularly and consistently with hospitals, with government to try to make this change. And actually, today, especially post COVID, with this scenario changing in healthcare, more and more financial protection is available for underprivileged families, right? So we have so many, we have the central government schemes, we have the state governments. In every state there are insurance schemes and there are welfare schemes for underprivileged families. The important piece is how do we ensure that families get access to this. So for an underprivileged family that may be going into a government hospital, more often than not, especially if you're below poverty line, you could be applying to the Rashtriya Arogya Nidhi. You could be applying to a chief minister's special assistance fund. And in addition, and importantly, is the Ayushman Bharat, the PMJ schemes. And because of the Ayushman Bharat, that covers not just government hospitals, it also covers private hospitals if you're an empaneled hospital. So, more and more financial protection is one piece that is actually being addressed in a better and better way. The important piece that we have to focus on is how do we ensure that the families, as you said, a family comes from a rural background, a family comes from out of town. How does he know what scheme, what is he eligible for? Does he have all the relevant paperwork, etc.? So what we have done at CanKids is that in addition to the help desk or the social support desk in the hospitals. We provide social support teams to the hospitals we partner with. And then we handhold the family. So we are like financial counselors. So if you provide a financial counselor, right? Even if you're an affording patient, you go to a hospital, the financial counselor will tell you this is what you can get out of your insurance scheme. The same way our social workers are trained in a program we call Sugamikaran, and through that program, we work with the family to say, which scheme are you entitled to? What exactly can you get? Where is your paperwork? What is the paperwork that you need to apply for the scheme? At the same time, many civil society organizations in India today are actually, including CanKids, we actually will provide the gap. We'll provide the funding for the diagnostics, we'll provide funding when the family cannot fully afford it. So when I first started this 25 years ago, Shubhangi, it was a very different scenario. And today I'm just happy to tell you on Universal Health Coverage Day that India has made such significant progress when it comes to financial protection for underprivileged families.
That's really great to know, ma'am. But I will like to talk about something that I learned yesterday. I was in a conversation with Dr. Rashmi Ade. She and I were discussing that, unawareness, like CanKids, and there are many other organization, government schemes made for, these children with cancer. But in the remotest corners of India where education doesn't exist, only labor or one day workers are there, and unemployment is everywhere. They don't even know that there are policies and schemes to help them. Do you think lack of digital awareness and basic education knowledge is a part of it?
So, again, I'm going to give you a positive answer because there is a really positive side to it. The government has got the entire healthcare system mapped out, right? So you have primary healthcare centers, you have CHCs, you have
Yes.
then district level, then you have the government medical colleges, then you have tertiary cancer centers, right? So when we work with the government machinery, what we are doing is that the ASHA worker, the Anganwadi worker, the RBSK officer, we are creating awareness at that level, right? And at the panchayat level, at the district administration level. So you are right in thinking that yes, is there awareness at the grassroots? We did a study for 2,700 patient families, and we found that it was taking median time 3 days for a mother whose child was sick to reach a healthcare provider. But the question was, does the healthcare provider know that this child might have cancer? And were they able to refer the child to the right place? Right. So a lot of the gap is not just about, and you're right in saying people are uneducated or people are lack the awareness or they don't know, right? But actually, you're not detecting cancer by saying, "Oh, my child has cancer." Your child has some
Exactly.
symptoms. You go to a doctor, right? And people know how to go to a doctor across the country, however poor they may be, right? You go to a doctor, that doctor needs to know, right? You get the point. The
Yes.
doctor needs to know till we arrive at a place that the child is diagnosed with cancer. So we want to make sure that the child is diagnosed with cancer quick. And then we want to refer the child to the right center. Right. So, the most important message, therefore, to families, to society is childhood cancer is curable. We need to get it detected in time and referred to a proper center at the earliest. Right. तो इसमें जो तुमने बोला ना अवेयरनेस की बात, वो जो अगर तुम्हारे बच्चे को सिम्टम है, then you will go to a, I mean, which mother will not take her child to the
Exactly.
doctor if the child is really sick or
Yeah.
has a tumor, gant, right? Or something in the eye or fever, which is unexplained for 3 weeks. She'll take her child to the doctor,
Yes.
whether it is to the Hakim or whether it is to the Panchayat doctor or whether it is to the community health center. Agreed or no? Of
Yes,
course, I can always
completely.
ask you if you have a child, you will have the answer to this one.
Yeah. So proper diagnosis at the right time is crucial. And
Yeah.
as you said, it is curable in most cases, right? So in many parts of India, again, coming back to the unawareness and a bit of lack of education, I would say, harmful myths around cancer exists. Like some people do believe that cancer is contagious. Children fighting the cancer are sometimes treated as untouchable, kept at a distance during gatherings, or avoided by other parents. मेरे बच्चे को भी हो जाएगा, my child will catch it. The mindset just does not isolate that particular child with cancer or who is a survivor, but it also kind of spreads into the community, and they refrain from supporting the cause or donating. Do you think this affects how the smaller scale uh, NGOs who try to support this patients or survivors in their working, does it become a barrier, this kind of stigmas and all?
So I'll answer your question in two parts. The first part is about the stigma. Yes, it's very real, right? And when we say it's very real, this is correct because a lot of people believe that cancer means death, right? And cancer itself is such a negative word that you're going to think that this child is going to die or my patient is going to die. And so, because of that and the fear that is surrounding cancer, people will not, they keep other children away. They're uneducated in the fact that cancer is not either because of somebody's fault or not because it's a chua ki bimari, etc. So that piece of it, that education is very important, and I agree with you 100%. That kind of awareness must be created, right? But also, the more we make knowledge, right, about the fact that there is so much progress in the world of cancer. Do you know there are childhood cancers which are 95% curable? There's an APML, which is a type of a blood cancer, which till a few years ago was like 30-40%, and now they've found very good drugs and protocols. So now children can be cured to the level of 95%. There's an
That's
eye cancer,
amazing.
retinoblastoma, which is 94% curable, not just internationally, but even in India. There's Hodgkin's lymphoma. So there are many cancers and children's cancers which have very, very high cure rates. So once people start believing that, okay, this is an illness which, if I get treated fully, will be fine. But we have struggled with the fact that the child will go back to his village and people will keep him at a distance. There will be children, the schools, even in urban cities like ours, school will say, oh, we need this child not to come in because the child has lost hair, the child looks different. And instead of principals understanding this or teachers understanding this, they actually have this kind of attitude. So believe me, it's not only in the villages, it's even in our cities where there's high stigma. So we do need to address that. We do need to educate, and all the media that you people do, all the awareness that you create is very, very helpful in trying to mitigate these problems. The second part that you asked me was that because of this, do NGOs struggle to raise funding? Not just small, even large NGOs, right? So we have the Corporate Social Responsibility Act, and a lot of people have their own definition of their own charter of what they will support, right? Climate change or health or education. Yes, we do encounter people who say, oh, we don't even know if the children will survive. Should we put our money into this? But things are changing. And they change when you change the messaging, right? So if the messaging is, look, in our country, right, children are surviving, look at the number of survivors, right? We encourage our survivors to come back and work with us as patient advocates and ambassadors. So when you see a child who has survived and is now leading a really good life, a lot of people start believing that, okay, fine, my child will also survive. And equally, donors start understanding that. So we encourage all the small NGOs also that ask your parents and your survivors to come back and be the voice, right? When we work on five rights, which is health, education, childhood, pain, freedom from pain, and the right to be heard. the more we will encourage our parents and survivors to come out and speak, the more this will go away. So we tell our smaller NGOs, ask your parents and your survivors to come and say what difference you have made, and you will then find it easier to raise funds.
Ma'am, as you said that, media professionals like us, people who have a voice, who have a sort of a power to influence a lot of people. I think some people, I don't want to name, like few months ago, this happened. A famous comedian, uh, who made a comment like, if you have a childhood cancer patient in your house and you're a parent, would you spend 3 lakh 4 lakh rupees on him who's like 2 or 3 months old, or go on a vacation? Like, you have just met him for 2 and 3 months and a vacation abroad. Like, he has so much power, he has like in millions of followers, and he's making a comment like that. So
That's terrible. That's terrible.
that's that's terrible, right? So I think we all as a society need to become much more responsible,
Yeah.
especially people who have a power like us to reach hundreds and thousands of people. We should be much more aware.
Yeah,
So
I think it's very important. I don't think anybody should ever question what a parent feels when their child has cancer, or for that matter, any disease that is, something which has a long-term fallout, right? I mean, every parent would always want to do their best for their child, right? And nobody else needs to pass judgment on that. I agree. But yes, we do have a responsibility. And people like me who are patient advocates, NGOs like us, we fight very hard for this. And we always ask the media to support us in positive messaging. If you don't do positive messaging, I have a housekeeper who said to me once, I know you do all this work, madam, but actually, doesn't everybody die? Because the only people who live are the people who go abroad for treatment. And I'm looking at her and saying, but I'm alive and I'm right here. And all these children who come to the house so often, they've all been through childhood cancer and they're surviving. So positive messaging is very, very important, Shubhangi. And I think all of us need to contribute to that positive message. Also, the hope is very important. The progress that we are making. If we keep talking about the fact that, oh, underprivileged families are suffering, when so much more help has come through, right? There is so much better access. There are so many more things available at hospitals, public and private, that if we don't talk about that and we don't put out that picture, right, then there's a challenge. Now, you asked me a question a little while ago about, will we struggle to raise funds, right? So I would never, therefore, paint a really dark and terrible picture just to be able to raise funds. When my reality is that I'm trying to find all every child should survive, right? So if I want every child to survive and that is the goal, then that is the goal I'm working towards. But I'm not going to keep saying that it is terrible just to get the funds. I'm going to remind you that for a mother whose child has cancer, it's the worst thing that you can feel, right? I'm going to remind you that for that child, as you started so beautifully at the beginning, that, it's that child's lost childhood, right? The pain, the agony, the just being deprived of a childhood, correct? That's what we remember. But a lot of people feel, oh, we must paint the most gloomy, terrible picture of India, and then we'll raise funding, or then we'll be able to create impact. I don't agree with that.
that's really inspiring, ma'am. Yes, like when I said that, like, the childhood, their entire conception of childhood, like when they will be survivors, as you said, most of them are curable, but when they will grow old, they would look back to their childhood as a nightmare, right? If proper support is not given. So when cancer hits, it changes you forever, right? Not only physically, but mentally. And here we are talking about a child, a little soul. And in your expert opinion, what are the most common mental health challenges that children with cancer develop?
So, it depends on the age, right? Because childhood cancer is 0 to 19 years of age, right? So, literally, a newborn baby can have cancer. And if you're 2 or 6 or 8 months or even 2 years old, maybe you won't even remember once you survive that you had cancer, right? As you get older, obviously, with each age group, how you react to your cancer journey changes. But whatever be the age, it's also a function of how good that journey was in terms of the support that you receive. So if you are going into hospital, and what we do is, if you provide a social support team, there's a teacher there, there's a psychologist there, there's a dietitian there, right? There's somebody to hold your hand through the journey. So what happens to many of our children? We provide teachers in the hospital, right? And when you've provided the teacher's job is that, okay, between your appointments, you're keeping the child busy, you're keeping the child entertained, you're providing the right to childhood. Children in the ward and the OPD are being given, school books, they're being given play things. We are celebrating whatever events, whatever festivals, birthdays, etc. Then we're trying to give them back their childhood. And if we are able to create that environment in a hospital environment, then the child comes to the hospital because of the teacher, or the child overcomes the fear of getting another injection because of the candy in the jar, right? And that is very important. And we think these things belong in the West, but I want to share with you that in India, in many, many hospitals now, including government hospitals, all the hospitals that we partner with, CanKids itself, we partner with over 140 hospitals across the country in 60 cities. But not just us, other NGOs have also started doing this. So there are NGOs that provide nutrition support like Cuddles. There are NGOs that provide beautiful homes for families to come and stay in when they come from outside the city for treatment. We have home away from homes. The St. Jude Childcare Center, people have home away from home. Access Life provides home away from home. So more and more it is common that you'll have a really nice multifunctional place where the family can stay. It doesn't have to be in the West, it's in India, right? In the hospital, they will provide us a school come playroom for the child, right? The psychologist is there and providing age appropriate psychological support to the child, the sibling, and the family, right? The nutritionist is taking care of the fact that this child has a particular nutritional problem. How do I take care of it? Because cancer is terrible. So you can have ulcers, you can have stomach issues, you can have nausea, you can have vomiting, and that child doesn't want to eat. And yet, if he doesn't get nourished properly, he's not going to be able to take the next chemo cycle. So, having a good nutrition plan, providing supplements, all these are important. Now, I want to share with you that you may think that I'm talking about the West, but I'm telling you that this is in our country now, in more and more hospitals, even government hospitals. And I want to share with you a little story. When we learned about child life, right, many years ago, this was, and we had a child life specialist who said, it's about telling the child and familiarizing your child in the hospital. So she said, if you put a play table into a hospital room, you'll see everybody's attitude will change. So this was at All India Institute, and we took a play table up to the daycare center. All the way up, and this was many years ago. So all the way up, even in the lift, people were, oh, can we also have a play table? Can we also put little play table for the children? And we put the play table in the OPD, and we found how attitudes changed, but how much the children loved it, right? So it's good that this is happening, right? It's good that in government hospitals now, I just came back yesterday from Lucknow, and we've started a BMT ward over there. In other hospitals, the it's no longer, we will only see the old shabby hospitals. There are lots of facilities being made available for families.
And this makes it clear that, this kind of actions are all a part of the recovery. It is not just the medical help. Obviously, it is the primary, but these things also are crucial for the recovery of the child as a whole.
And
Yeah.
Subhangi, you mentioned earlier about fundraising. So when we
Yes.
first started, and even now, people will often say we'd like to give funds for the child's treatment because that's most important. But we kept explaining to people that other holistic care is so important. A family can abandon treatment, a child can fail the treatment if we don't provide all these other aspects. So now it's standard in the world that we work in of childhood cancer, and I'm not just talking about CanKids, but across the board, that people are talking about holistic care. And we are getting a lot of funding also for holistic care, not just for medical treatment. So attitudes are changing, and it's very, very heartening.
It really feels good to know that as a society, I would say the word evolving, we're becoming much more socially responsible.
Yes,
Thank you,
yes.
ma'am. Okay, so we will start with our next round, which is the rapid fire round. I'll be
Oh,
asking you.
before we go to rapid
Yeah,
fire, you have to give
yeah,
me 2 minutes because I
yeah.
really want to tell you what is happening with universal health coverage since it's
Yes,
Universal
yes,
Health Coverage Day, right?
yeah.
So last year in September 2024, we invited Dr. Vinod Paul, member Health Niti Ayog, and we launched with all the stakeholders of the community the universal health coverage for children with cancer initiative. And universal health coverage is two things: one is access, and the other is financial protection. We talked about financial protection earlier, but the other piece of it is how many children who may have cancer are getting detected, diagnosed, and reaching a cancer center somewhere in the country. And our goal is that by 2030, this should be 100% access, 100% financial protection for every child with cancer in the country. And so I'm really delighted that we are able to work with governments, we're able to work with hospital institutions, we're able to work with doctors, we're able to work with a lot of other NGOs. And we have something called the Indian Childhood Cancer Initiative, which is our multi stakeholder platform, which unites the entire pediatric oncology childhood cancer community. And together we are working on this universal health coverage goal of 2030, which is mandated by the WHO and the United Nations.
I think you and these organizations, I think they are at the core of pediatric oncology. They're like the face of childhood cancer care in India, and I can't be more inspired, and I'm
Thank
proud
you.
that I'm part of a nation where organizations like CanKids exist and leaders like you exist. It's
Thank
so
you.
inspiring, ma'am.
Thank you.
Uh, is it okay if we move to the rapid fire round now?
Yeah, sure, sure.
Yes.
Thank you for
So
giving me the time to be able to talk about
obviously,
universal
ma'am.
health coverage.
No, no, definitely. Universal health coverage means accessibility, affordability, which is this year's theme, and I think useful
And quality
just yeah,
patient-centered care.
yes, yes.
Yes,
So
yes.
for my first rapid fire question, if you could change one thing overnight in India's childhood cancer care system, what would it be?
So at the current time, the one thing we're trying to change is early detection and diagnosis so that we can find more children who can come in and access care. At the current time, and since we started first on this, it was around 19-20% of the children accessing care. Today, we're up to 55%, and we want to get to 100% because once they access care, then they start surviving. So that's one thing I'd like to change today. You ask me this question next year, and I might have a different answer.
Wow, I really hope so, ma'am. Are there innovative solutions from other countries that you think India could adopt immediately to better support children with cancer?
So, in 2018, the WHO launched the Global Initiative on Childhood Cancer, and they developed what is called a cure all framework, right? And what we have done is that we have adapted and adopted that and developed our own healthcare framework. And it is for us, it is under what is called Sehbagita, which is to do with patient centered care. And so we have adopted the cure all framework, and that is the basis on which we're doing health system strengthening. But we're also doing hold the hands of family. You are not alone. So that innovation we picked up from Childhood Cancer International. You mentioned that I'm the rep at the WHO rep for Childhood Cancer International in South Asia. And that was an innovation that they taught us, that you hold the hand of the family, you provide all services, you don't let go of the family at any point, and we call it "you are not alone." So we've already adapted from the two leading things that can actually drive really strong system change.
That's great, ma'am. For childhood cancer survivors, what is the single most overlooked need once treatment ends? Like post cancer, after the child is a survivor, what is the one thing that is overlooked the most in their care?
So the most important thing right now that we're looking at is reintegrating them back. Actually, as a country, we have become more conscious. As a community, we're becoming more conscious that once, because our focus has been on survive, right? Obviously, in a low middle income country, you're looking at let's first get the children to survive. But so for a long time, we were not looking at, okay, what happens to the survivors after that? Do they go back to school or college? Or did they have post traumatic stress disorder? Did they have late side effects? Did they never go back into society? So now we've started working very hard on reintegrating them back into society. And that's the most important thing. And a lot of work has happened in the last, I would say, 5 years with two NGOs, CanKids, as well as the Indian Cancer Society, OGAM, with a lot of hospitals setting up survivorship clinics and actually encouraging the survivors to come back to do their follow ups regularly. So I think that, and understanding that, okay, did they miss education, did they have other long term side effects, focus is there on that now. But the most important one, since you said rapid fire, is to do with reintegrating them.
And lastly, if as if all the children who are fighting cancer right now, as someone like you who has gone through this hell, if you could give them one message, like a piece of hope, what it would be?
I think there would be a commitment from us that every child with cancer should survive and should thrive, and that there is a whole community out there which is trying to integrate cure and care so that our children in India get the best possible treatment, care, and support, and that we are there for them. You are not alone.
That's so inspiring, ma'am. Thank you so much. Thank you so much for joining us today. It
Thank you.
is
I've had such fun.
incredible. Yeah.
I've
So
had such
you're,
fun on
yeah,
your show. I
yeah,
like
you're
your
so,
voices. I like your voices for health shows. They're fun. This is the second or the third one I'm doing.
that's
Okay.
amazing, ma'am.
Take
So
care. Thank you.
your expert opinions and advice on supporting children with cancer have taught us all a lot today, and we have so much to reflect on. Thanks a lot again. And to our audience, as we leave this conversation, let us remember that every child out there who is fighting cancer deserves hope, care, and a life filled with possibility. Supporting them is not just a health responsibility, it is a call to our humanity, a step towards a kinder and a more compassionate India. Thank you all for joining us and being a part of this meaningful conversation.